Okay, so we are here. It is almost mid-July,
Hmm.
2015, in my office clinic in Fort Myers, Florida.
Hmm.
This is Dr. Scott Geller, the go-to guy for eye floaters, and here we have an esteemed physician who is on. What are
I
you on the
mean,
staff of?
I'm a staff at the one of the university hospitals
Which one? I mean, for
from Alberta,
what
in
med?
Canada.
Is that a medical school hospital or?
There's a medical school hospital.
Right. So tell us what your symptoms were.
Well, the I came to, or rather, the problem I had was I developed a left-sided posterior vitreous detachment, which caused the formation of a Weiss ring and a membrane attached to it, and a little small apron-like stuff associated with that. I was told the usual way that put up with it. You should probably go away, and so I did put up with it for about 2 months, and but it kept going into the visual axis and the problem with Weiss rings when they have a membrane attached associated with it is it tends to cause a lot of distortion, especially in front of computer work, looking from the computer medical records, writing on the piece of paper. There's a lot of distortion. There was bring up my blood pressure actually. Very
it was
grumpy.
it was disturbing. But you also had another interesting thing, which was you had a congenital cataract at a fairly young age,
That's
correct?
right. That's right. I have a genetic loading, I guess, thanks to the family history. I have early cataracts, pre-senile cataracts, they call it.
Yes.
And I had the cataract surgery done about a year ago. So I've got toric lenses put into both eyes as well. And then to make things more complicated for Dr. Geller is that I have lattice degeneration, which had been lasered down as well. So not as simple as one would be.
Yes, and I told you that I have never once in all these years had a retinal detachment, either as a primary detachment
Mm-hmm.
or a secondary detachment. I've done many cases
Mm-hmm.
with scleral buckles, which is the ultimate retinal surgery. So
Mm-hmm.
we gave a presentation, a poster presentation at the Academy of Ophthalmology in 2012 on 500 cases, and my
Mm-hmm.
particular series, had zero retinal detachments. The
Mm-hmm.
other guys, some patient had one maybe 6 months afterwards, but
Mm-hmm.
I don't attribute that to cause and effect. So anyway, you had actually 4 laser sessions, which,
Yes.
but I got the majority of the Weiss
Oh,
ring after the
yes.
first sessions, correct?
Correct. Exactly.
And then there were a few little pieces of
Correct.
debris, and a lot of doctors just don't understand that you can't get it in one session. There is a limit to the safe amount of laser energy you want to put in, so it has to be spread out. But at this
Yes.
point, just before this last session of a few shots this morning, would you say how many percent, would you give it a percentage of being
Oh,
going?
yeah, definitely in excess of 70-75% more overall because I'm a obsessive person.
Yeah. Well, that's good. Everybody wants an obsessive physician for their doctor.
Yes.
But and you certainly know what a placebo effect is, and this is certainly not a
Oh, this is
placebo
definitely not
effect.
placebo. And now I can eat breakfast with my wife and my family without a thing bothering me, or even when I'm driving. It's very obvious. I mean, you're sitting in front of a computer, you're seeing this stuff. I don't. I mean, if you put a blindfold on my eyes, it's very obvious.
Yeah.
And if you take it off, it's very obvious. I don't believe in the nonsense of a placebo for something like this. This is
Of
totally
course,
bullshit.
obviously.
Yeah.
I did have a retinal specialist say, well, this could be placebo effect, but then again, you have to believe the patient, of course, right?
Correct. Correct.
So you're happy with this. What did your ophthalmologist up in at Edmonton, right? Isn't that where you were?
Correct. Yeah, exactly.
In
Yes.
Alberta. What did
Alberta.
they?
Yes.
Yeah. What did they think about laser?
Oh, he said that it wasn't based on randomized control trials. So from the overall perspective of the discipline, it's not a standard treatment, which means that people like me will have to suffer. I guess the alternative was a vitrectomy, which is not very pleasant in my mind. So it's to me this is much better. Now I'm going to holidays in a couple of weeks from now, and this is at least out of the way. I'm so happy.
Well, I certainly hope that you do show the video to your retina people up there. But
Yes.
what you have to tell them about a randomized prospective trial is that the result will depend on who's doing it and their experience. And if he started a randomized trial, he would not be getting the same results as me.
That exactly. So trials are really dependent on obviously the choice of patients and definitely the skills behind it, though.
In fact, we discussed the other study that was being done in Vancouver that they abandoned because they felt the patients were having a placebo effect. But I just believe that was poor patient selection to begin with. I think they took everybody who came in complaining of a floater, thinking that they could do it. And of course, they had probably zero training other than maybe a lecture or two. They didn't watch over somebody's shoulder like me to know how to do it right. Anyway, we do it right down here, and it's always good to have a physician as a patient. It's my favorite thing, and maybe the medical school will pop for me to fly up there, and I'll give a lecture. All right.
All right.
Okay. Thank you for being a great patient.
Yeah. No. Thanks. We're very happy.